Now, I would like to discuss some case studies. Laurie Ferguson is yet another example of how traditional medical approaches not only fail to provide relief to pain sufferers, but often fail to correctly diagnose the problem. Laurie's ordeal began after she was involved in a car accident. She suffered whiplash, a torn muscle extending from her shoulder to neck, and a concussion. She began to suffer from excruciating headaches that incapacitated her on a daily basis. She experienced a burning sensation in the middle of her back and an aching, pulsing pain along the right side of her head.
My name's Laurie Ferguson. I'm a registered nurse. I was in a car accident in 1997 and actually didn't have any deficits until April of 1998, where I started with chronic daily headaches. And I got to the point where I was vomiting and having grand mal seizures. And what they were doing was just giving me medication upon medication upon medication to deal with that. And I actually ultimately lost my job because I was missing too much work. I have gone through to pain management specialists to help deal with my headaches. I had one doctor tell me that the only hope that I had was to go on OxyContin or methadone, which I was not willing to do because I was not willing to give up my nursing career. I have gone and had acupuncture with a chiropractor. I did massage therapy 3 times a week. And I just was not a person to settle. I needed to know what was going on with me. And I went to a neurologist, and then I ultimately got sent to therapy, psychiatrists and psychologists, because they thought it was all in my head. And they started putting me on Seroquel and all different other kinds of medication. They alluded to the fact that they felt I had been sexually abused as a child. And I'm not sure if that happened or not, but I did question my mom because I never remembered that happening, and they were calling it post-traumatic stress disorder. With my confusion and loss of memory at times, they were saying that I might have early dementia. I was tested for that, and that was fine. And I know that my neurologist got really disgusted with me and finally just said, I'm not treating you anymore, I'm taking you off all your medications. I then went to Boston to a headache specialist, and I received 40 Botox injections every 5 weeks to help curb these headaches that were daily. And I've gone to emergency rooms when I've been having them, and they tell me that I was a drug seeker, and they wouldn't give me even ibuprofen. And as a nurse, that's really hard to take. And one of my last jobs, because my coordination was off and they accused me of having slurred speech, they pulled me off the floor 2 hours after I had been working, and I did not have any medicine in my system. I immediately went to the emergency room and demanded that they do blood tests. The ER doctor told me I could go back to work, but they wouldn't let me go back to work, and ultimately they terminated me. And it wasn't until I well, I need to back up. I was sent to another physician, a neurologist down here in Maryland by my PCP, and he sort of looked at me like I was this crazy lady and was very upset with me that I was taking Furoset with codeine, and they were going to put me in the hospital for a week-long DHE drip, but they told me I had to be off of all my medicine, and then I was going to have to be on phenobarb and Klonopin for 1 week. And I was not willing to do that because I'm not willing to give up my nursing. I was sitting in my PCP office, and I happened to see Women's Health magazine and was flipping through it, and I saw Dr. Ajrawat's advertisement on peripheral neuropathy and pain management, and I immediately went home and I called and I came here. And the one thing I can say about Dr. Ajrawat and his wife is they believed me. And for the first time in my life, I felt believed. And he did injections in my back, and he taught me the meditation therapy, and I have not taken medicine for my headaches since March. I do the meditation faithfully. It's changed my whole life. It's made me a calmer person. I'm now working full-time. And I just really want to thank Dr. Ajrawat and his wife for believing in me and helping me get this far, because my family wanted me to go into a drug rehab. My first husband divorced me for being a prescription drug addict, and he was attempting to have an affair with a family member because he said, quote unquote, they were safe and he couldn't deal with my headaches. The man that I've married now is a godsend. He's very supportive and very helpful. And, you know, it's just, there are times that I can honestly say I would never admit to a psychologist that I've ever thought of suicide, but there were times that I did because nobody believed me.